listen to it again afterwards, I think we'll get started. So again, my name is Amy Joyce. I'm the director of the Office of Child Care, and take a moment to have my colleagues introduce themselves.
And my name is Tammy Scott. I'm the Field Operations Director with Office of Child Care.
And my name is Alyssa Chatterjee, and I'm the Governor's Deputy Education Policy Advisor.
My name is Remy Watts. I am helping out today. I am the Early Learning Council Administrator and Rule Coordinator at the Early Learning Division.
So one of the things that Remy's going to be doing for us is watching the chat box for questions. So if you have specific questions, please put those in there and Remy will flag those for us. We're going to go through some material to start, to lay some foundational information, and hopefully answer some of the questions already that you have, and then we'll move into Q&A. So put those questions in the chat box and we'll get to as many as we can. And again, thanks for joining us. So I want to start out with just some foundational information. So, you know, when we entered the emergency childcare space back in early to mid-March, and the governor put out her executive order, and Miriam Calderon, the director of ELD, put out her temporary order, sort of implementing that executive order. One significant change among many was that recorded programs needed to apply and be approved to be quote unquote emergency child care operators. And this was a system set up to provide some oversight and ensure that recorded programs, in addition to licensed programs who would be reopening as emergency child care, would be informed of and following the requirements that were put in place to, you know, reduce the risk of transmission of coronavirus and COVID-19. So including things like stable groups and cohorting, sanitation and cleaning requirements, those sorts of things. And so now as we move forward, we're using, in addition to Miriam Calderon's temporary order, we have 3 documents. First is a guidance document that the Health Authority and ELD put out just over 2 weeks ago. This was an update to some earlier information. The second document is the safety procedures and guidance for child care facilities, which in our COVID context includes recorded programs, and then also the cleaning and sanitation documents. So you'll see up on the screen those 3 documents. They all work in coordination with one another. Those documents are online, and I will say, and I'll put this up on the screen at the end as well, but if you want links to any documents, put your email in that chat box and we'll capture that information and send you information after this is over.
So hey, Amy, we've got a couple of questions that came in from that section. I was wondering, can you explain prioritizing essential workers' children? Can families return to preschool if they are not essential? Also, what changes in terms of curriculum do we need to consider? Sensory play, group experiences, had another question about clarification on the use of sandboxes. Are they safe?
So can you pause there for a second, Remy?
Yeah, sure.
Great. So, and Tammy, so could you go, I'll ask you to do this, Remy, if we could just do like one question at a time, that's going to be, that's helpful.
That was technically one question.
Oh, well, okay. So
a long one.
Topic. Yeah. Okay.
Well, and I'm thinking, Amy, maybe we go through our slides and then we have a Q&A at the end where we can go through and do all these questions.
Yeah, that's a great idea. So Remy, why don't you hold on those until we make it through some of this, and hopefully some people's questions will get answered as we go through.
Okay.
So we'll just hold on that for a second. Thank you a lot. I appreciate it. So we're going to start off with again, an overview about how recorded programs interact with this system. So again, recorded programs have to be approved as an ECC if they want to operate, again, within their recorded program capacity. So, you know, we have recorded programs that are sort of, you know, after school or before school. For preschools, 4 hours a day or less, children ages 3 to 5, and for school age, again, a program that does not take place of a parent's care. And you know what you are if you're a recorded program. So if you want to be operating like that, you still need to apply and be approved to operate as a recorded program. If you want to be operating outside of those usual limits and operating as childcare, we've seen some of that since the beginning. People refer to these loosely as pop-up childcare. So not licensed childcare, but folks with childcare experience, like a recorded program, operating as childcare. At this point, if you want to be doing that, you need to be, applying and getting approved. But to get approval, you're going to have to demonstrate that there's a need in your community for childcare. And this is in recognition of the fact that while we allowed pop-up childcare, thinking that there would be much more demand than we had capacity, what we saw was the opposite. There was much more capacity for childcare in our state than there was demand. And so we need to be winding down those pop-up childcares. And so to remain open or to open a new pop-up type childcare, then you're going to need to show community need for childcare in your area. So again, to operate as an approved ECC, operating as a recorded program under your usual parameters of time, you have to follow the guidelines outlined in again the Director Calderon's temporary order. We issued an amended one of those on June 2nd. That can be found online. And that continues to require stable groups of no more than 10 children. So that cohorting requirement people talk about. You have to adhere to the COVID-19 sanitation and cleaning schedule and the safety procedures. And again, like I showed in that earlier slide, all three of those documents working together to reduce the risk of transmission of coronavirus and COVID-19. And again, you can see the link there. All those documents can be found on our website. And if you've determined that you can't operate and adhere to those requirements, then the answer is you need to close. So I'm going to stop there and ask if anyone has any questions about the grant opportunity that recently closed, and we're working on processing grant applications. So Remy, if you could scroll through and see if anyone has grant questions, or if you do have grant questions, post those now. We'll try to do that.
Here we go. If your recorded program has already been approved as an ECC, do you have to reapply? My program starts in September. What is my timeline to get approved to operate? Will grant applications reopen?
Okay, can we pause there?
Definitely.
Okay. Betsy, are you on the line yet?
She is on the line. I can see her.
Yeah, I'm here understanding Scott's name. Can you hear me?
Yeah.
Okay. I'm sorry, what was the question?
Why don't we start off, if your recorded program has already been approved as an ECC, do you have to reapply?
So that I think is not a grant question. So I think the short answer right now is no, you do not need to reapply. If you're an ECC, however, that's operating as childcare, we will be contacting you pretty soon about how you're going to wind that down.
Okay. Will grant apps reopen?
Hello. Yes, we are going to have another round of applications, and we'll have more information about that next week. However, currently we're not planning on recorded programs being eligible.
Okay. Another question. My program is church owned. Can I apply for a grant?
That has the church ownership has no bearing on your eligibility either way.
I think the rest of them are general questions and not necessarily grant related.
Okay.
So I think we can move on.
Okay. So let's keep going, and we're going to, we had
Oh, wait.
some.
A second. Recorded programs can't apply for the grant?
They are, they have applied, and maybe some of you have applied for the one that we're currently doing right now, and we are making many awards to recorded programs, but in the future round, recorded programs will not be eligible.
Okay. So we've been getting a lot of questions about the intersection of recorded programs and summer camps. So we took the most frequently asked questions we've been getting and kind of developed what we thought would be the most topical questions. And we want to walk through those with you all so you can understand, again, that intersection of these two things. In normal times, you know, summer camps operate, they're really outside of childcare regulations. But this year, in these extraordinary times, where we have recorded programs being required to be approved as emergency childcare, we also have guidance document out from the health authority about the operation of summer camps and requirements having to do with reducing the spread of coronavirus and COVID-19. So we want to walk through those real quickly and answer some of those up front. So I'm going to ask questions, and Tammy's going to give us the answers. So question: I operate a recorded preschool. Can I offer preschool summer camp?
So as Amy mentioned, the Oregon Health Authority did put out sector guidance for summer camps, and it's very specific to school-age summer camps. Any programs that are offered for children under the age of, I'm frozen on my screen, Amy, can you hear me okay?
I can hear you, Tammy.
Okay. So any programs offered to children under the age of 5 do not fall into that school-age summer camp guideline. And that is considered childcare. It is required to be an ECC, and you are required to follow all the requirements of the ECC, which does include the stable groups of 10 children maximum. So you don't have the same freedoms with younger children as the older school age camps have.
Okay. Question.
And I do want to mention, even with the older school age camps, there are a lot of restrictions that are very, very similar in that sector guidance for the school age camps, but the younger children are required to be listed or approved as an emergency childcare.
Okay. So the next question is, as a recorded preschool, can I offer preschool summer camps with week-to-week enrollment?
So we've been getting this question a lot, not only from recorded programs, but also licensed childcare, and the answer really is no. This year we are in extraordinary times when we have public health crisis, and the requirement for being an approved emergency childcare, whether you're recorded or licensed, is that you have stable groups of children. So that doesn't allow for week-to-week changes to your children. The only way that you could do week-to-week enrollment is if every single week the entire group changed and during that week it was stable. If you have any children going more than 1 week, that is not a stable group and it's not permitted this year.
Okay. Next question. I operate a school-age recorded program. During the summer, we cease to operate our recorded program and offer summer camp for school-age children. Am I allowed to do that?
Yes, you can do that. And that's going to fall under the guidance that was put out by the Oregon Health Authority for the school-age summer camp. We have a link there for the sector guidance, which I know doesn't do you a whole lot of good because you can't click on the screen and go to that link. But we will, like Amy mentioned earlier, if you put your email address in the chat box, we will email out the link to that document so that you're very clear on what the guidelines are that you need to follow.
Great. Next question. Do I need to close my ECC while operating summer camp?
And the answer is yes, and it's a little more complicated of an answer than just saying yes. So if you are a school-age recorded program, and during the summer, you're going to have 2 segments of your program running. So you're going to have that recorded aspect of it and you're going to have summer camps, then you would want to leave the ECC open. But if you're not operating your recorded program during the summer and you're just doing your camps, then yeah, you should go ahead and contact the person who did the inspection on your facility and close that down. So now we're just going to open it up to you all for questions, and I know it sounds like you have quite a few. So Remy, if you could just go through and do one at a time.
Sure. So one of a recurring theme is, what is the difference between children ages 5 and younger from older children, and why can older children be in a summer camp but younger cannot?
Well, and in terms of what I can speak to is licensed childcare and our recorded programs, because those are the programs that we oversee. And the requirements are very specific that up to eligible for kindergarten, you're considered preschool age children. And then once you hit kindergarten, you're considered a school age child. Melissa, I don't know if you can speak to the thought process behind the information that came out from Oregon Health Authority around school age.
Yeah. So a big differentiator here is that we know for preschool age and younger children, physical distancing is very difficult to maintain. So that's where cohorting becomes especially important. Summer camps, due to being school age children, it's a bit easier for them, particularly in the older ages, but even in those sort of early grades, to maintain physical distancing. So that's really what kind of becomes the difference between programming for pre-kindergarten and infant and toddler children versus school-age children. And again, to Tammy's point, we're not operating as normal, and so these sort of differentiations are being put in place given our current circumstances.
Cool. Thanks, Alyssa. You might know the answer to the next question. Another theme is that, so how long do the groups have to be stable, and can there be different cohorts of stable groups throughout the summer?
So I think what that question is getting at, and jump in please others, you could have a new group of 10 every week, and that would be okay if children aren't carrying over week to week, because that group within that week is stable. So theoretically, in a month, you could have 4 stable groups that come through your program. You just can't have any children crossing over, because then that group is no longer stable.
Awesome. I hope that clarifies that. There was another question. So there was one question that was something to the effect of, where is it? Sorry, there are a lot of emails coming in intermittently as well. In the morning, are you allowed to have 2 stable groups, like one in the morning and one in the afternoon? So, is it okay to run a recorded preschool as ECC in the morning and then run a recorded school age program summer camp in the afternoon?
You can do that, and you can actually run a recorded preschool and a summer camp for school agers at the same time. They don't even have to be at different times. They have to be separate children, separate staff, and clearly separate to the parents. But you could have one part of your program doing a preschool recorded for 4 hours or less with ages 3 to 5, and then have a school age summer camp going alongside it, and that would be okay as long as they're kept separate.
But definitely, I'll just add on to that, as Tammy indicated at the beginning, if they wanted to have a morning program and then an afternoon program, and you're keeping those cohorts of children separate, then absolutely, that's fine. We do encourage, essentially require, do that cleaning and sanitation in between. I'm assuming here we're talking about like at a facility. We're not out in the woods someplace. But if you are at a facility in a building, do that cleaning in between your cohorts of children to, again, reduce the chance of transmission of the virus.
Awesome. So another question, do we need to have a communicable disease plan to operate, or was that guidance for summer camps?
You know, OHA is who runs the summer camps, and I'm not super in-depth familiar with the summer camp guidance, so I would suggest that you refer to that document and refer to OHA for questions about summer camp rules.
So there are some remaining questions about people who have different stable groups on different days. So is it acceptable to have different groups on different days? So a group A on Monday, Wednesday, and then group B on Tuesday, Thursday with no crossover between the two groups?
Yep.
That is allowed, and same thing as Amy mentioned, cleaning and sanitizing in between groups.
Awesome. And can you explain how a recorded program operating in the summer is different than a summer camp? What are the main differences?
Yeah, so, and actually I was speaking to a gentleman from, I think, a Boys and Girls Club not too long ago, and what he described is that during the school year, and to be qualified as a school-age a school-age recorded program, you have to not be taking the place of a parent's care, which means the children can come when they want, leave when they want, and you're ultimately not responsible. And what he described during the summer when they transition to these camps, that there is absolutely an expectation by those parents that when they drop those children off, that camp is responsible for them. So that's how it is different than a recorded program.
Okay. And another follow-up question is, can you have the same staff for the AM/PM program?
Yes, you can.
And then a lot of these other questions are relating to the information that you just talked about. Let's go with one last question. We're getting a lot. Let's go with one last question. When do you anticipate fall guidelines will be issued?
So I don't think we have an estimate for that. We do calls in the evening with various childcare sectors. We've been doing them for a couple of weeks now. And every time we're on, we get the question of when are we going to go back to normal? You know, when's the new set of guidelines going to come out? And my answer is always the same. And I wish it could be a better answer, but it is what it is. So the answer is we don't know. You know, we have to, allow the virus to control the timeline, right? It's the virus's timeline, not our own. So we are watching constantly the data on coronavirus. So new cases, hospitalizations, deaths, and how that is trending. And we're watching what's going on in the various counties and the phases and what's going on in other sectors of the economy. Unlike some of the other sectors that are county by county, childcare and by extension recorded programs is statewide guidance. That's true for now. I can't say that that's going to be for the duration of this whole thing, but for now it's statewide guidance. But we're keeping our eye on all that information to make decisions about when we might start changing some of the guidance, like just as an example, you know, could we increase the number of children in a stable cohort, that sort of thing. So we're constantly assessing that, but I don't have an answer when it's going to happen. I wish I did, and I just don't.
Amy, can I give you one of these other questions?
Please.
Can you explain prioritizing essential children, and can families return to preschool if they're not essential?
So, so prioritizing the essential workforce, I mean, it means the same thing that we've said from the beginning. So it does not mean you can only serve the children of the essential workforce. You should prioritize them. The second thing I'll say about that is the essential workforce is very expansive. Many people have thought that it means, you know, medical personnel, police and firefighters, and maybe grocery store workers, and that's it. And that is not the case at all. We have a link on our website to a federal definition that frankly goes on for pages and pages, and it's really like who in our entire economy like kind of keeps things running in our economy. So first of all, take a look at that, and you'll probably find that many families that you serve are part of the essential workforce. and it is prioritizing. So we want to make sure those folks are able to access care, not childcare, of course, your recorded programs, but access the care and the services that you provide. And then in addition, with the new guidance that came out about 2 weeks ago, it expanded to others who are going back to work. So, really this is quite expansive, and really families can be returning to work and sending their children to preschool.
Great, thanks. I'm going to address the next question that I can see that was lumped in with this one. And it was about changes in terms of curriculum to consider. And what I'll tell you is one of the documents that we've referenced is the Safety Procedures and Guidance for Childcare Facilities. And it's one of those links that's on our website. And that really goes through and gives guidelines for how to operate right now. And within those guidelines, you can make choices for your program. Some ideas around curriculum that are in this document are about reducing spending time in whole group activities, limiting the number of children in each program space, such as learning centers, increased distance between children during table work, plan activities that don't require close physical contact. So there's ideas like that in this very document that is on our website. And then you also asked about sandboxes, and we actually have been getting that question just in the last few days, and we put that question to Oregon Health Authority because we do need some guidance on sandboxes. We do have guidance that says that water and sensory tables should be discontinued. So when you think about doing water play with children this summer, think about sprinklers where the water is flowing and moving, and not so much a sensory table where the water is stagnant. And then also, if you put your email in the chat box, for licensed programs, we've developed a resource guide to help plan some curriculum ideas that will support social distancing with children. So I'd be happy to include that in the email that we send you also with the links. There's a question here about, were recorded programs informed of the change via email updates? We have sent out updates and have included recorded programs in those mailings. So I can't speak to the exact mailings, and I'm not sure which change that this question is exactly referring to, but we have included recorded programs and advised them when they needed to become an ECC, an emergency child care. Play-Doh, that's a good question. Is Play-Doh allowed? Haven't received that question yet. You're on these calls with people day after day, and every day there's something new. So we will take that one forward, that and sandboxes to OHA. Great question. I'm writing it down now. Unless you've heard anything, Alyssa.
No, I've not heard about Play-Doh.
Good question, though. Can you elaborate on group size? Well, it's pretty easy. The group size is 10. And within that 10, you actually can fill those 10 stable spots with up to 12 children, meaning you could have a couple part-time children sharing a spot. But that really applies more maybe for licensed programs because they're operating all day long. Amy, do you recall if that applies to all ECCs?
I'm sorry, I couldn't quite hear you, Tammy.
Do you recall if the allowing 12 children in a stable group applies to all ECCs? I think it does.
Yes, absolutely.
So the way that we've described it is, if you think about having a baseball team, you might have 12 people on the baseball team, but only 10 play at once. So it's the same thing within with your stable group, that you can only use total of 12 children. So if you have a couple part-time children that substitute in for a couple other children, that's okay. Oh, Alyssa, this is kind of a question for you. Is this decision solely up to the governor? Or is there local county decision-making in these things? And are there forthcoming changes to how these things are decided?
Yeah, so thus far, child care guidance is statewide. It is not impacted by the county phases. And this guidance was developed as a partnership between the Office of Child Care, the Oregon Health Authority, and our office. Local public health is consulted by the Oregon Health Authority when sort of adopting final guidance, just to make sure that local public health has capacity to provide supports when necessary, that there's no concerns about impacts on outbreaks and things like that, generally speaking. But it's a collective decision ultimately between our office and the Oregon Health Authority. We are continuing to work as counties do move through phases, as we learn more about the virus. We're continuing to learn, and our hope is that there's changes to childcare operations to allow more flexibility in group sizes. But at this time, it's a statewide set of guidance that does not have any planned changes as of this moment.
Okay, next question. Are recorded programs that have been closed currently eligible to apply to open as an ECC? Amy, you want to take that one?
Got myself off mute. Okay, so think about recorded programs in two different ways that they've functioned to date during COVID times. The one way is normal recorded program operations, right? That limited, you're not operating as childcare, you're operating as a recorded program. Yes, you need to apply and be approved as an ECC, and we can continue to process those applications, no problem. And we turn those applications around very quickly right now. It's a matter of days once you submit your application. The other way that recordeds have operated during this time is a handful of recorded programs applied to operate as full-blown childcare. And we talked about this a little bit earlier, where we have entities that are not licensed childcare, but because they had a lot of childcare experience, we allow them to open as childcare very temporarily to deal with any kind of influx of need during this time. And some recorded programs applied to do that, and we allowed that. What we found is that we have more capacity in childcare than is needed. And really, as time has gone on, we need to get back to the situation where fully licensed childcare are the places that are offering childcare. So if you're a recorded program that wants to be offering full-blown childcare, yes, you would need to apply to be an ECC, and you're going to have to show that there is a demonstrated need for childcare in your area, right? So basically, the need for childcare exceeds the capacity, and you're basically offering a service to the community. That's what you would have to show at this point to get approved as an ECC, as a recorded program that's operating as full-blown childcare. Long answer, but that's the situation.
The next question, Amy, is a bit of a follow-up that I think I'm going to tag on to you a little bit. This is somebody who currently is not operating their recorded program, and they're wondering for fall if they should go ahead and apply as an ECC and how long it takes. Amy made mention that the process is pretty short. We turn those applications around fast. But what is different now for a recorded program that's never been the case before is you actually have to meet a longer list of standards and have an inspection done by one of our licensing specialists. So in terms of the timeline really is dictated by how quickly you have your program ready for the inspection. If you go onto our website, in the COVID-19 section of our website, there's a tab that's for emergency childcare. And if you look on the tab that says Emergency Childcare Toolkit for Non-Licensed Temporary Emergency Childcare Pop-Ups, as Amy said, pop-ups, you have to show community need, but if you're just going to operate within your recorded program capacity, it's actually the same tab that you'll click on. And that'll give you a guide that'll say what the requirements are to be approved as an ECC. That's a little bit beyond what you're already doing as a recorded program. So that'll get you started in the process. And it is a pretty quick process. The requirements aren't too demanding. See if there's any more questions. How do recorded programs demonstrate community needs?
So I think that's a situation where you need to be, looking at your community and talking to perhaps community leaders. You can be talking to us as well about whether there's a need, right? Are there enough childcare slots in your area, your town, your city, your county, your neighborhood, whatever the area is? So community leaders, childcare providers that you may be familiar with, and communicating with our office. So we have a pretty robust database of what childcare is open, how many slots we believe to be available, that sort of thing. So that's how you would do it. So, but you need to be looking at whether your community needs childcare and it isn't there before you're, applying to step up and offer something that you wouldn't normally be authorized to do.
And I was looking at the next question, Amy, so I'm not sure if you mentioned it, but we do have a database that shows us how many licensed childcare slots are available throughout the state. So that's really largely what we use to determine that community need. Next question is an interesting question. I'll be curious to see how you answer it. You feel a little set up there, sorry. Okay, can you have a child come 5 days a week if you have a Monday, Wednesday, Friday, and a Tuesday, Thursday group?
So I would say no, because I think what you're talking about is this child is part of two different stable groups. That's how I'm hearing that question. And then they're not stable
Yep.
groups. Yeah. Yep,
I agree. We just haven't had that question before. It's always so interesting to see what we get. Okay.
It's a great question. I love all these practical questions. This is what we're here to answer.
Are the stable groups required to stay in their designated area room each week? Are we able to rotate the assigned areas to give kiddos some different challenges and variety? I would say, oh goodness, I don't want to speak off the cuff there.
Let me step in for a second and clarify something, Tammy. I heard week to week, not day to day or morning and afternoon switching, week by week.
Right.
I'm gonna jump in there and I'm gonna say that sounds okay to me, because you're effectively swapping your stable groups. It's the cleaning thing, folks.
Yeah.
Clean that room, and now you've swapped stable groups week to week. That sounds like in the spirit of what we're talking about here.
That was going to be where I was going to go to. Daily swapping would be really doing a lot of cross-contamination, but if you're going a full week, I think that's okay with good thorough cleaning in between.
Yep.
Okay, so 12 in the total pool, but 10 of the same children on any given day. So yes, 12 on the team, but 10 on the field at a time. So you might have 4 children total that are part-timers, so they're swapping slots. And we are going to have a handout that we're going to be making available on our website very soon that will also give a visual for this. But you might be doing care or offering your program Monday through Friday, and 2 children come on Tuesday, Thursday, and 2 children come on Monday, Wednesday, Friday, and they make up that 10 stable group. But there's actually 12 children filling the spot. Do you want to open as an ECC in the fall? Do you need to apply now? I don't think you need to apply yet, but I would suggest that you go onto our website, look at the Emergency Child Care Guide for Temporary Childcare, so you can see what you need to be preparing for. It really will be a pretty fast process as long as you have everything ready. And by the fall, everything might be different. We just don't know at this point. Okay. I'm confused about the stable group of 10. I'm reading there needs to be a 1-to-5 ratio. No, it's a 1-to-10 ratio. It's not, yeah, with 10 children, you need to have 1 staff, but it is not a 2 staff for 10 children.
Tammy, can I jump in there for a second? Is there any situation, and I'm asking you, I honestly don't know the answer, and you're the expert here, but when we talk about different aged children and different ratios of supervision, anything there where it's less than 1 to 10 in the recorded program? situation?
Not in recorded. For licensed, yes, because they have children under the age of 3. But because recorded program preschool is the ages 3 to 5, that's at a 1 to 10, and then school age is also at a 1 to 10.
Okay, thank you.
Great question on the next one. The application requires the ELD background check, and recorded programs can't do that. How do we apply? Amy, you want to take that one?
Yes, the answer is yes, you can. So what we're doing at this time is because fingerprinting is not available really in many places. So our normal process of being enrolled in the Central Background Registry, or the CBR, is not necessarily available. So since the beginning of this situation, we've been providing for emergency background checks. And we do allow effectively anybody who's going to be operating, you know, childcare, recorded, pop-ups, all these things. You need to get that background check done, but you don't need fingerprints. It's I think it's name and date of birth, Tammy. Maybe name, date of birth, social security, no, name and date of birth, I think.
Oh, no. For the background check, we need address, we need former names, main names, anything. We need your birth records, you know. No, it's a normal background check.
Okay, so all the information that's going to be on the form that you'll find online, but not fingerprints. I do know that, and that can be done very quickly as well, because what we're effectively doing is an in-state check and then other information that we can find online for other states. We're not going full-blown FBI background check that we do with the Central Background Registry. So yes, you do have to go through the background check, the emergency version, and we can do that for you and get it done, and there is no cost for that.
The next question was about sensory tables, and I want to refer back, get in front of my camera, to this document that is a link on our website. And again, it's the safety procedures and guidance for childcare facilities and other early learning programs. So this is one of the documents that you guys need to be familiar with and following. And it does actually specifically reference that sensory tables as not being allowed during this time. It's the Play-Doh and the sandboxes that we need to get clarification on. So I'm not sure what this question is asking. We really can't function as ECC according to the answer that you gave at 135, which I, of course, don't recall what that was, but also can't apply for the grant. This is not sustainable. Yeah, so I think the concern is that they are not an ECC and they didn't get the grant the first time, and now they're not going to be eligible for a grant this time around because it's not going to recorded programs. And I don't know, Betsy, if you have any response for that.
Well, I will just say that there's not enough money and there's too much need. And some of these grants that we're giving out are as small as $700. So we're trying to find a way to make sure that there's an opportunity for everyone, but I do know that it's a very tough situation. So that's, I don't have any great words of to make it better, but that's the insight that I have.
So really quickly, I just wanted to tell you that the comment that you made, Amy, that caused that question, it was because you indicated that recorded programs have to prove a need in the community to operate as ECC. Just to follow up.
So let me be really clear about this. I hope I didn't misspeak, but in case I did, and there's a lot of nuance to this, so I want to be really clear. If you're operating or want to operate recorded programs, you need to apply for and be approved for ECC. Okay, full stop. You must do that if you want to operate. If you want to operate your ECC as full-blown childcare, so beyond what you normally do, you're going beyond recorded, and you're offering, full day, whatever, it's childcare. This isn't your normal operation. That's when you need to show community need, and the community need is there isn't enough childcare in my community. And so I want to expand what I normally do, what I normally wouldn't be allowed to do because I'm not licensed childcare. I've got to show community need. That's the difference.
So there's a question about having more than one stable group. You can have as many stable groups as you have classrooms. So if you have 5 classrooms, you can potentially have 5 stable groups. With the ECC approval, of course, and inspection by our licensor. Are there counties where sufficient capacity does not exist, specifically Lincoln County? You know, I can't address Lincoln County off the cuff. I don't have the data for that, but what I can tell you is I know there was a very small rural county yesterday that had a program that applied that we did put it through because there was nothing there for parents to use. So it is possible.
So I would say contact our office.
We can kind of look at that for you and look at that data. Oh, okay. Does a recorded program that serves children of a something that are seeking services at a homeless day shelter need to prove there is a need to operate? I think that's an individual circumstance, and I would encourage you to contact our office and we'll explore that more with you. Okay, this we talked about in our presentation, but I think it went by too fast. If you're a school-age recorded program that's been approved as an ECC and normally run a summer camp, sorry, apparently I have another meeting in a few minutes. If you're a school-age recorded program that has been approved as an ECC and normally run a summer camp, do you have to close your ECC for the summer, or can you continue to operate under the ECC guidelines? So you have choices. If you're going to continue to operate your program as a recorded school-age program, meaning you're not responsible for the children, you're not taking the place of parents' care, children can leave whenever they want to, then you keep your ECC open. If during the summer your program switches to a summer camp model where children are dropped off, parents are leaving them with you, you're responsible for them today, then you're going to shift over to that summer camp model and close your ECC. Looking forward to fall, can I have a group of 10 kids in the AM and a total different set of 10 kids in the PM on Monday, Wednesday, and Friday, then another set of kids on Tuesday, Thursday? You can have stable groups that are Monday, Wednesday, and Friday, and Tuesday and Thursday, or AM and PM, as long as you're cleaning in between and keeping them separate. You can do that now. You don't even have to wait for fall for that. What benefits are there for a recorded program to apply as an ECC childcare versus an ECC recorded program? Do the hours of operation change for childcare versus ECC? Amy, do you want me to take that?
Yeah, why don't you take it, Tammy, and then I might say something more broadly when you're done, depending on what you say.
Right. So I'm going to answer this assuming that we're talking about a preschool recorded program. Preschool recorded program is very, very limited. You're only allowed to have children in your program that are between the ages of 3 and eligible to attend kindergarten. And you can only have children in your program for up to 4 hours a day, 4 hours or less a day. So if you're wanting to care for any children under the age of 3 or operate for more than 4 hours a day, you have to be a licensed childcare, or right now show community need, and then you can be an ECC childcare. Outside of those two scenarios, you are very limited about what you're allowed to do, because if you're going to do anything other than that, you have to be licensed.
Thanks, Tammy. And I am going to speak a little more broadly. And this gets into an issue, and I heard something like this and something like this kind of topic on an earlier call that we had having to do with camps. And here's the reality. We have recorded programs in this state that I'm just going to be very frank, probably are not operating as recorded programs and are really operating as childcare. They're two fundamentally different things based on what's in the statute. Childcare is childcare, and recorded program is very different. So if you hear us talking about these things like the child can come and go as they please, and you're not taking the place of the parent, and that's not ringing true for you for what your program is, the reality is then you really shouldn't be a recorded program, because what you're really doing is child care. And this is just a fundamental thing that I think has gone on for a long time, and we're not going to address it right now. We're going to fix any problems or address it right now. But I think going forward, you know, this whole situation with the emergency childcare has really kind of elevated that we have this really difficult crossing of these two things. And we just know, and we can tell from many questions that we get, that folks are operating what is effectively childcare and calling it a recorded program. I'm not lecturing anybody. I'm not calling anybody else. I'm just saying it's a reality of our regulatory scheme that has developed over the years. And so going forward, you know, I think policymakers and we as regulators might take a look at, you know, whether we need some changes in that vein. And this is actually really incredibly timely because just yesterday, the Secretary of State issued an audit of a couple of different agencies that do background checks in the world of childcare. So they audited Office of Child Care's background check system, DHS's background check system that they do for some folks who receive subsidy for childcare, and also the Oregon State Police sex offender database, and how all these things work together. And one of the recommendations from the Secretary of State to really shore up the safety of children in our state is that the Office of Child Care should be doing background checks and enrolling people in that central background registry who are staff members providing care at recorded programs. And we agreed with that recommendation, and we'll be putting forward a legislative concept to do that. Like I said, that audit just came out yesterday. You can find it online or read it in the news. But so I think you can see from that and some of these questions that have come up that there are, you know, really some, you know, ways in which we can be improving child safety and oversight in the world of recorded programs. So I'll just let that, I'll just say that for now and encourage you all to go and take a look at that audit.
Okay, next question. Some of our students have adults that help them in the classroom. It's like MECP, which I'm assuming is some sort of a therapist or early intervention or something, or other supports. Are those adults allowed in the classroom? Want to take that, Amy, or you want me to?
Would you please, Tam?
Sure. So right now, Amy explained that the emergency background check process is available to recorded programs and actually is required if you're going to be operating your program, because you have to be approved as an ECC. And that background check is very easy. It's free to you right now and very quick to accomplish. And so any adults that are in the program must go through our background check process and be approved. And I know that the guidance that I keep referring to, because I want y'all to take the time to read it, does talk about not having additional adults, but only having the adults necessary to meet the ratios of the classroom. We got a lot of feedback on that because a lot of programs are really trying to be very intentional with their children, intentional with their cleaning programs. So we did go back to OHA and we got some revised guidance that says you can have an additional staff person in there if that's needed for the care of the children or the cleaning or to be in compliance to support your program to operate the best that it can. So it is okay to have extra adults as long as they have the background checks required. And of course you have the approved ECC. Oh no, okay, next one, Amy, I'm gonna let you do this one. Can you have different volunteers in an ECC preschool classroom each day?
Tammy, have we addressed that before? I'm not sure if we have gotten down to that kind of level.
Yeah, it goes to not allowing extra adults in the group. So I would say, no, you can't have, and we told other licensed programs that they can't have their volunteers rotating in and out. It's just too much exposure to the children and then going back out. And since they're a co-op preschool that typically has a teacher plus several parents in the classroom. Yeah, you just really can't. You have to have the same stable staff with the group every single day and not have a lot of rotating happening. Do you know if phase 2 will change ECC?
Yeah, so you know, we've talked about so far the fact that the child care guidance today is a statewide set of guidance. It's not changing county by county or with phases. Now, I can't say that that won't evolve over time. It could. And I know I've seen the news as well as you that some counties are going to be applying to enter phase 2 here pretty quickly. So I think as we, again, I said early on, you know, we look at the science, we look at the data, we look at what other sectors in the economy are doing to help us evolve what the child care guidance is. But for now, it's statewide, not county by county.
So I see we're down to 4 minutes and we have several questions left. I want to make sure to get to this one. Do recorded preschool only programs need to submit an application to OCC? Yes. Right now, COVID times, there's my alarm again. During these COVID times, all recorded programs is to operate in your recorded program capacity. So your recorded preschool less than 4 hours a day. You're not allowed to operate unless you've been approved as an ECE. So right now, if you haven't done that, you're going, oh, I didn't know that. Get on our website and look at the guide and get that application in, because right now you are not approved to be operating. Okay, how long is the turnaround for background checks? Pretty fast. The background checks that we're doing now, because it doesn't have any fingerprinting, is actually, I mean, if the record is clear, it's a 5-minute check. So I would say, you know, a week and a half really turn around, because you never know if there's a backlog in our process. Oh goodness, 157. If we're a recorded school age program, no preschool, do we have the option of operating under camp guidelines? Yes. So if you are a school age recorded program, you have a decision. You need to look at your program and you say, am I operating as a recorded program this summer, meaning I'm not taking the places that your parents care, children are able to leave whenever. If that's your answer, then you need to apply as an ECC with Office of Child Care. If the program that you're running in the summer is taking the place of the parents' care, the parents are checking them in, the children are expected to be there all day, you're taking care of them for the day, parents get them at the end of the day, and that's your summer camp program, then you need to follow the OHA summer camp guidelines. Okay, last question, 158. If you can have 12 per week, why can't we do that for alternating weeks for summer care? Example, children who only come every other week due to split households. It's still 12 on the team, but 10 on the field. I think if you're having solid groups of children that are just coming certain weeks, that's fine. What you can't do is have one child from one team cross over to the other team the next week. But if you have a stable group one week and a stable group the next, and then back to the first stable group, that's okay. You just want to do the cleaning in between. Any addition to that, Amy?
Nope, I think that's right, Tammy.
Okay, last question. Can a recorded program operate for full day programming? Based on what was said, we would need to apply as a full-blown child care. So Amy, this goes back to community need. You want to talk about that one more time?
Yep, I think that's right. I mean, if you're not going to operate as a summer camp, right? So we're keeping that separate. If you want to operate as childcare, you can apply, but you need to demonstrate that community need.
Okay,
and I think we are officially out of time.
Can we do one more question?
All right, we're going to the same meeting, Tammy, so sure.
Well, our next meeting is you and me, so we're good. Okay, if we have 3 summer camps with weeks in between with no children, can the same kids attend the next camp? If it's the same group every time, well, no, okay, we're in summer camp mode, okay? So I have to clear my brain. Are you talking school age summer camp or preschool summer camp? School age summer camp, you need to refer to the OHA sector guidance. That's not in my realm, so I couldn't tell you what that answer is. If it's preschool summer camp, as long as it's the same exact group that is coming multiple times, that's okay. But if it's changing up the children, then it's not.
All right.
Okay.
Well, I want to thank
that's it. I'm sorry.
Yeah, we're at
everybody.
Yeah. So if you have additional questions, do let us know. Shoot us an email, and we'd be happy to answer those. We'll collect emails from email addresses from the chat box if you're asking for a specific document. Thanks so much for joining us, and And thanks for all that you do.
Can you put that last slide back up so they can see the email address maybe?
Let me see what I can do. There we go. There's our email address. Send that in. That goes to a general email box to